Are you trying to figure out how to occupy your time? Hi, I'm Dr. Lindsay at LifeWorks, and here's another project to occupy your time if you have to stay home right now and can't work. Do some research on how to stay well. Why? Because the people who are at high risk for getting serious cases of COVID-19 didn't get that way overnight. If anything like this happens in the future, you may be able to prevent yourself from being in a dangerous situation. But you should start now. I think it's safe to say that most people who are now diagnosed with heart disease, diabetes, and other serious chronic illnesses were sick for years before it came down to being able to label them with those diagnoses. They might not even have realized it. They didn't have as much energy, their back hurt, they weren't thinking quite as fast, they're gaining a little weight, and they couldn't easily participate in sports with their friends. They thought they were just getting older, but most of the time, these things were symptoms. Symptoms that could have been resolved with a healthy diet, a healthy lifestyle, preventative health care, and just nipping those symptoms in the bud. Instead, they're now in a high-risk category. I know it can be tough to change your lifestyle, and it can be confusing. Where do you start? What do you do exactly? Not having answers to those questions is often the thing that keeps you from being able to progress. But with a little more information and help, you can do it. If you need help figuring out what's right for you, give us a call. We'll be more than happy to talk to you. So you're not high risk at this time. You don't have diabetes or heart problems, but chances are this sort of thing will happen again. While it's true that some people get ill for genetic reasons that may not have been figured out yet, many people become ill because of their own behavior and their failure to follow up on symptoms and physical problems. You can find top athletes who truly are in good shape and medical professionals who should know what has to be done to stay healthy. They're still becoming ill with chronic diseases or dying. But most of the time, something led up to it. You could have seen it coming. If you smoke, you know it might weaken your lungs. If you eat junk food, you know it's not really nourishing you. If you start getting overweight, you can see it, and you can do something about it.